Good morning, everyone, or good day, depending on when you hear this. I want to briefly talk about chronic obstructive pulmonary disease, or what's known as COPD. And this is more so of my personalized approach through exploratory visualization. So let's get started. Again, my name is Naja Thomas, and let's get started. So, one of the most important things is to really understand why did I choose to address this issue? Like, what is the importance of this specific project? And so, there is a burden of COPD because of it's highly prevalent and it's a chronic respiratory condition, which affects millions of people worldwide, leading to the causes of morbidity and mortality, which significantly impacts the quality of life, healthcare utilization, and as well as an economic burden. Um, the economic cost is driven by different factors. It could be direct healthcare costs or indirect costs. And there is a challenge that many people who have or who struggle with COPD don't fully understand their condition, or really understand how to navigate within the healthcare system, and they don't have the ability to actively participate in their own care. So it can lead to different delayed in diagnoses, disease management. There is an increase in healthcare utilization as well as associated costs. Um, Poor quality of life and clinical outcomes for COPD patients. And so, what all of this is saying is that there needs to be a more personalized approach. And what I mean by personalized, I mean, we want to actually create a data visualization, different data visualization strategies, because it makes a great point in enhancing and enabling for a better COPD management. So what I'm presenting today is just information that's just more clear, engaging, interactive way of really reviewing and understanding the data visualizations. And this can help with improving patient understanding of COPD and its management. It can also help with facilitating better shared decision making between the patient and as well as the healthcare providers. And this is also important for empowering patients to actively participate in their own care and self-management, as well as to optimize healthcare resources utilization and to reduce those economic burdens. So let's move on to the next slide. And I want to actually talk about my project introduction. What is COPD? It is a chronic progressive lung disease. It's characterized by obstructive airflow, which leads to symptoms like chronic cough, increased production and coughing of mucus, as well as shortness of breath slash difficulty breathing. It is a major public health issue, mainly among older adults, which again leads to morbidity and mortality. But one of the key components is during COVID-19's pandemic, there was a more so vulnerability of individuals who had pre-existing conditions such as COPD, which highlighted the urgent need for improved management and preventative strategies. So for my project focus, I will look at exploring the geographic variations in COPD prevalence as well as the impact. I will look at incorporating social determinants of health to better understand their influence on COPD outcomes, as well as a more personalized insight into visualization tools to enhance patient care. And I will be using Tableau to create a more detailed visualization of different geographic locations, stratifications, and social determinants of health. And so what I did was actually, I want to go to, so looking at some exploratory analysis of data, we have these different areas, high risk areas of social determinants of health we can look at. We also have like states of COPD prevalence. We have the two states that I focused on, which was Florida and California, Cali, for COPD cases. We also have the age range and gender of COPD cases. And then we can look at the comparison of Florida and California cases by the year, as well as like the high risk locations focused on like stratification breakdown. We can see that white non-Hispanics typically develop COPD, mainly in California. In California, we have Florida, we then have Texas, we also have New York, and we have Ohio. We also are looking at just the different states, and we can really see uh different states, its variability between the chronic states as well as the COPD prevalence. And then we can also look at the top cities with the high COPD prevalence as well. So my anticipated impact. So through data visualization tools, I want to enable primary care providers to quickly identify early COPD signs during routine checkups that leads to a timelier diagnosis and treatment. So with this interactive data dashboard, what it does is it's mainly for empowering patients to actively monitor their own disease progression and treatment, and just fostering a sense of just ownership over their care. So with this predictive analytics integrative tool, I hope to anticipate and prevent COPD symptoms, thus by just reducing costly emergency department visits and hospitalization. And this collaborative platform will help to accelerate scientific discoveries and the development of next generation COPD management solutions by like facilitating knowledge sharing among researchers, clinicians, and patients. And so unnoticed stage, this is just some just brief information. And then my future research studies, my conclusion that I won't really go into, just wanted to touch on some key components, my reference, and that's it for me. Thank you all, and please, please, please like, share, and subscribe. I know it was a quick just a review, but I really have other topics that I want to talk about and go through. Just a quick, briefly review of my research projects that I've been working on. Thank you so much and have a great day, and talk to you guys soon.